Hi, everybody. My name is Dr. Hannah Lee, and I am one of the clinical psychologists over at Counseling and Psychological Services. And so I've put together a webinar here for you today. I really hope that you find this to be helpful for you. This workshop or webinar is called How to Face COVID Mental Health in Quarantine, and it was done as a Zoom workshop, and now we've changed it into a recorded webinar so that anyone who views it at a different time can still benefit. So I will go ahead and get started. All right, just as a reminder, I am not here with you live, and this workshop is not therapy. So if you are interested in counseling, we do encourage you to call CAPS at 909-869-3220, or go to our website for more information on how to contact us or to learn about our services. If you feel you're experiencing suicidal thoughts, the National Suicide Prevention Lifeline is available 24 hours, 7 days a week. If you feel like you cannot keep yourself safe, please call 911 for immediate assistance. Excuse me. You can also go to our website and see what other workshops we're putting together, and that's always available for you. All right, so I know that sometimes I'm in a Zoom meeting and I'm the doggy on the left. So whatever position you're in, wherever you're watching this webinar from, I hope that you're feeling comfortable and that you are in your element and that you can just take it easy and hopefully you can learn something out of this time. So this is going to be the overview of what we go over today. FACE COVID is an acronym that was created by Dr. Russ Harris. He is the author of the book, The Happiness Trap, and he is also a practitioner of acceptance and commitment therapy, or ACT, which goes into a lot of these methods. So he put this together specifically for COVID-related concerns, specifically as it relates to our mental health and how to cope and manage. So FACE COVID, we're going to go through it together, each one in more depth, but I wanted to kind of have you all kind of get a sense of where we're going. So let's go to our first slide. So we want to acknowledge that COVID-19 is challenging for us on many levels. You know, it's not just physically, but emotionally, economically, socially, and psychologically. This is a pandemic that is just impacting us in so many ways and so many levels. And so whatever you're experiencing, whatever you're going through, we want to acknowledge and validate that. And during this time, feelings of maybe fear or anxiety is normal and inevitable. And it's easy to get lost in worrying about a lot of things, you know, that are outside our control. What might happen in the future, how the virus might affect you or your loved ones or your community or this country or the world, and so on and so on. And while it's completely natural for us to get lost in fear or anxiety, in excess, it may not be helpful or useful. And the more we focus on what's not in our control, the more hopeless or anxious we're likely to feel. And I like to differentiate fear and anxiety. Fear, I would say, is an emotional response to real or perceived immediate threat, whereas anxiety is the anticipation of future threat. So it is the thinking about the things that have not yet happened, and yet it worries us, concerns us, but then sometimes that can result in a lot of physical reactions, mental reactions, psychological reactions. And the reality is that during this time, there's a lot of things that people are experiencing, from fear and anxiety, like I just mentioned, whether we're maybe anxious about ourselves, family members, health, whether we have enough to survive, whether we're going to have enough money or financially, how long, what is this toll going to do, and do we have enough to last through it? We can also be experiencing depression or boredom, so maybe a sense of feeling sad or low, and maybe the extended time spent at home causing maybe boredom or even loneliness. anger, frustration, or irritability. And again, this also is valid, but it can be a sense of, because of our loss of agency, our lack of personal freedom. And sometimes it could be a lot of anger or resentment at the people who have a say in your freedom. So people who make laws, or people who are not following the laws, and you're doing your best to take things seriously, but maybe there are those who aren't. It could also be uncertainty or frustration about how long this is all going to take. And a lot of these things are going to result in very complicated emotions. Not only that, but on top of the COVID related issues, there's also the reality of being a student. As I'm recording this, we're right in the middle of week 15. So that could be a time of preparing for finals. For those who are graduating, it could be, gosh, how am I going to transition into the workforce? Is there going to be jobs available for me? No one is getting back to me. What now? The what now is, and maybe the grieving over, gosh, I'm not able to graduate the way that I like. I can't celebrate this milestone the way that I would have imagined. So again, a lot of multiple transitions and many mixed emotions. Now, a big concept that I'm going to be really repeating throughout the workshop today is this idea of acceptance. So this is a really great diagram to help to illustrate acceptance. So on the left, we have it's raining, but then maybe some thoughts like, I don't like rain. I wish it wasn't raining. I wish my day would be better if it wasn't raining. My day is ruined. Every day it's like this. It's always like this. Why does it always rain when all I want is for it to be sunny? Some of these you may kind of identify with. And then on the right is, it's raining. Yep. Okay, so the difference is that it's the same scenario. It's raining. Nothing is changing that. But on the left, there's a response about it where we're kind of stuck in the reality that it's raining and what it means and how it's limiting us and how we don't like that and all the things we could be doing if it weren't raining. And on the right is the sense that, yes, I don't like this, but that's what's happening. And that's the acceptance piece. And I'm going to talk a little bit more about why this is important. And that's why the F of face COVID is focus on what you can control. We want to recognize that you have control over your behavior and how you occupy your time. What we don't have control over is the future. We don't have control over how long COVID-19 is going to impact our lives or our economy or how our government manages the situation. And although you can't magically control your feelings and all the fear and anxiety that you may feel in response, you can control what you do behaviorally and how you occupy your time. And that really matters. The reason that it matters is because when we feel helpless, when we feel like we don't have a say, that's what actually contributes to a lot of the anxiety, the fear, the helplessness. But when we feel like I have some control over something, that's going to give you a sense of lessened anxiety. Again, it may not be everything, but there's a sense of I can control something right now. And the reality is we have far more control over our behavior than we do over our thoughts and feelings. So the number one aim is to take control over our behavior to respond more effectively to this crisis. If we look at this diagram here, we see that there's an inner circle of things you can control, and then outside of that are all the things you cannot control. So things like if others follow the rules of social distancing, what are other people doing, other people's motives, how long this is going to last, the amount of toilet paper or other supplies in the store. Those are all things we cannot control, and I'm sure you can name more. And then in the inner circle are things that you can control. So my attitude, whether I'm going to be following the recommendations of distancing and the recommendations of hygiene and disinfecting, whether I'm limiting my social media, how I'm spending my time at home. And again, the reason we do this is not to minimize the reality of what's happening or the seriousness of what's happening, but we do this to regain a sense of control. And that is really important to maintain your mental health. So F was focus on focus on what you can control, face, right? A is acknowledge thoughts and feelings. Now, why is this going to be important? the reason is because we don't want to ignore the thoughts and feelings that are coming up for you, because they will come up. And this could be anything, emotions, memories, urges. And we want to be curious and observe what's going on. And as we do this, we may even put some words to it, like, you know what, I'm noticing anxiety within myself. I'm noticing grief. I'm my mind is worrying. I'm having fears of getting sick. And when we do this, we want to do it compassionately. And we do this compassionately because we cannot control the thoughts and feelings we're having. These are just knee-jerk reactions. And sometimes we either try to avoid the thoughts and feelings that are coming up. So we might say, I'm good, I'm fine, we're good, like I'm handling this, when really there's other things going on and we're just ignoring that. Or we may be, wishing ourselves better and pretending it's not there because we think it means something about us, that I'm weak for having these thoughts or feelings, or I'm not grateful. And so again, we want to acknowledge it with compassion and recognize that you are not your emotion. You can have difficult emotion, but it doesn't mean that you are less than or weak because you have these emotions. These emotions are natural. And again, it's very difficult to make emotions go away, but we want to acknowledge them to get to the next step. Now, after we focus on what we can control and we acknowledge our thoughts and feelings, we want to do C and E of face, which is come back to the present moment and engage in what you're doing. What it means to come back to the present moment is that sometimes we get so caught up in our worries, our thoughts, or fears, is that we go along with it mentally, right? We are 5 years down the line, or we are thinking about things that have yet to happen so far in the future. Or maybe we think back to all the things we regret or wish we could have done differently in the past, and we're not engaged in the present moment. So in order to engage in the present moment, there's, definitely some techniques. This is one. And a lot of times the techniques are ways of grounding yourself into your physical body, into the present moment. So on the left side, I walk through a couple of steps. So on the left side, it says, slowly push your feet into the floor, right? Slowly straighten your spine, sit upright, and push your shoulders back. Slowly stretch your arms or neck, shrugging and rotating your shoulders. And as we're doing this, we're slowly inhaling and exhaling. And we do this to just take a minute to snap out of the things that we're thinking about, to come back to the present moment. And by doing this, again, we're also gaining control over the things that we can do in this moment. And then we do the steps on the right. So look around the room and observe through your 5 senses. So find something you can see. So right now I'm facing a window, so I can look above and I see trees. I see the leaves blowing because of the wind. Find something you can feel. So actually right now my laptop is on a piano, so I'm feeling the keys of the piano. Find something you can hear. So I don't know if you can hear this, but I actually have a fan blowing right next to me. So right now if I pause, I can hear the whirring, the fan blowing. Find something you can smell. I have a sparkling water with lemon. So if I put my nose in there, I could actually smell a little scent of lemon. And then find something you can taste. I'm gonna, very refreshing, sparkling, a little flat. Again, why do we do this? These are ways of anchoring us into the present moment. Again, rather than getting caught up with all the different things and worries we have going, these are called grounding techniques or mindfulness techniques. And I think of these 2 steps as a way to let down your anchor. So an anchor is a device on a vessel, usually a ship, that when you release it, it goes down to the floor of the ocean, and it's heavy enough that it will actually anchor your boat from drifting too far with the current or the wind that's going on. And grounding techniques is our anchor. It's our way of connecting to our body in the present moment so that we can take a moment to recognize, how do I take control over my actions, my breathing, my focus, and then we return our attention back to whatever it is that we were doing and give it our full attention. All right, now committed action. We've done face. Focus on something you can control, acknowledge your thoughts and feelings, come back to the present moment, engage in what you're doing, and now we're doing COVID. C is committed action. Now, committed action is any action you take because it's truly important to you. Now, you might want to repeatedly ask yourself throughout the day, what can I do right now, no matter how small it is, that improves life for myself or others I live with, or the people in my community? And whatever that answer is, do it and engage in it fully. And again, it doesn't have to be major things. It could be simple things. But again, what can I do to improve my life and the life of others? What feels like a committed action for me? And this could be, even though I feel really frustrated, I have the ability to stay home and I will. Or it could mean right now what's most important, what will improve my life is to really buckle down, study so I can pass my finals. Or it could be, I'm going to take some time. I have to work, and although I would love to be at home, I need to provide. But if I'm going to be at work and if I can't avoid it, what actions and steps can I take to make sure I'm safe and as safe as possible? It could also mean things like, I'm going to do my best to continue to exercise at home because my health is really important to me. And I don't want to lose that while I am in this quarantine situation. So again, think about the committed action. What feels valuable to you and what can you do in this moment? O means open up. And again, open up means to make room for difficult feelings while being kind to yourself. Now, this sounds a lot like acknowledge your thoughts and feelings, and in some ways it really is. And I think it's okay that it's in here more than once because this quarantine is going to continue to go longer, we're going to have a lot of different types of emotions. Maybe in the beginning, it's, I can do this. It's going to be okay. It's not that bad. I have Netflix. Or, I've been meaning to read all these books, or I've been meaning to, take some downtime. But as it continues to roll through, you're going to notice, gosh, I have different feelings. Now I'm feeling bored. Now I'm feeling anxious. Now I'm feeling really, I'm getting cabin fever. I need to get out of here. Or I really thought that the stimulus check that my family received was helpful, but now I'm really starting to worry. So again, difficult feelings are guaranteed to continue to show up as this crisis unfolds. It could be fear, anxiety, anger, frustration, confusion, you name it. Again, I want to remind you, you can't stop them from arising. They are normal reactions, but we can make room. We can open up and acknowledge them, acknowledge that they are normal, and allow them to be there, even if they kind of hurt, and treat ourselves kindly. Self-kindness, I would say, is essential if you want to cope well in this crisis, especially if you happen to be someone in a caregiving role, if you are a student parent, or if you're working in a field as you're going to school that cares for others, or if you're caring for someone who is sick, or if you are, providing emotional support to somebody else during this crisis. If you are in any sort of caregiving role or plan or hope to be in the future, it's very important that you learn how to take care of yourself with kindness in the midst of it all. I think of self-kindness as, and this kind of metaphor. So if any of you have flown before, when you get in a plane before you go off, you often hear this announcement. It'll say, in an event of emergency, the oxygen mask will come out from the ceiling. Please put the mask on before assisting others. And again, self-kindness is your own oxygen. if you cannot tend to yourself, you cannot sustain this process, and you don't want to pass out, right, before you can help others. So it's very important to take good care of yourself. Values. Now, this is probably my most favorite slide of all the slides, because values is essentially what grounds us in the committed action that we saw 2 slides ago. So, and values is going to be different based on the person. Someone's value is going to be different from your values, and that's okay. And what's important is you figure out, what are my values, and what are the values that are going to help me stand in the face of this crisis? What are the things I want to be thinking about in terms of who I am, what I stand for, or how I treat others? And I think it's very important to get a sense of your values. If you've never thought about it, this is a good time. If you're watching this, put a pause, put a stop, and look on the diagram and figure out what your values are. Now, if you look on this diagram, there's kind of a myriad of values. And again, it could be things like family. Family is really important to me. So whatever I do, I want to do it in the service of my family. Or it could be, citizenship, community. I want to do things, I want to take action that is consistent with my commitment to this community. It could be spirituality. During this time, I really feel more connected with a higher power, and I'm going to be praying, I'm going to be connecting with my spiritual community. It could be your education and career. My assumption is that most of you watching this video, this is going to be a value. Otherwise, you wouldn't be at Cal Poly Pomona and in college, right? So is this the value that's going to be pushing me forward? Now, here's the why behind why this is important. Values is what helps you endure discomfort. If something is valuable to you, you will tolerate things that make you uncomfortable, because that value will push you forward. So I'll give you an example. Trying to finish college in 4 years is very difficult. 4, 5, 6, that may be the average. But, and that amount of study, that amount of papers and midterms and finals, again, is very difficult. And yet, why would you put yourself through something that is that long and difficult if you didn't value education or what it will do for you in the future? So when you value it, you're more willing to manage and tolerate the discomfort. I'll give you another example. So your social life or friends is really valuable to you. Now, in this time, it may be very difficult to socialize or have friends in the same way. However, if you feel like it's valuable to you, you may go out of your way and be more uncomfortable to maybe meet this value. So it could mean that, I really hate FaceTime. I really hate calling people, but right now that's all I have. So I'm going to be doing that. Or I'm going to drive and drop off a care package. And even though that's something out of my way, and I really feel comfortable where I'm at, but I'm gonna go out of my way to be doing that because that's something valuable to me. And the good thing about values is that it always feeds back. When you're able to do things that are consistent with your values and you meet it, that's what gives you meaning and purpose and drive. So the I in COVID in our acronym is identify resources. And again, this is very important because our student population, and you may identify knowing that all of you are going through different types of struggles. Those struggles can be, figuring out how to work with this remote instruction. It could be, what are the resources out there? Is there still tutoring? What is this? How can I take advantage of the credit, no credit policy? How do I petition during this time? Or it could be things like, gosh, I am in a really tough situation and I need to look into emergency housing. What's out there? My family is worried about foreclosure. How do I find out about postponing or deferring mortgages, right? So it's very important to know what your resources are. And if you don't know, please reach out to the Counseling and Psychological Services Office. We have a case manager who is on every day, kind of collecting the most updated resources for all of our students. So if you need assistance with our Cal Poly Pomona emergency grant, our short-term emergency housing, or if you need to know about who's hiring right now, even if it's a minimum wage job, I need something, our case manager can be helpful in that. Also, if you realize that at this time you're really needing a little bit more support than you are getting right now, we are still doing counseling by phone and Zoom, and we're also doing more workshops. So please reach out to us. You can just type in counseling or CAPS when you go to the main Cal Poly Pomona website and find all of that information or contact information. Please leave a message and we can reach out to you as well. And D, we're getting to the end here a little bit, but D is disinfect and distance. Again, I don't think this is new information, but I do think it's worth reiterating. The reason we do this is because our value is for a community and our value is towards the health of everybody. So although it's uncomfortable, I do encourage you to continue to maintain these practices of disinfecting and distance because again, it's better for all of us. Now, I did want to leave you all with some more practical tips. The things we've covered so far are more like theoretical, or maybe what kind of perspective should I be having during this quarantine? What kind of mindset should I be having during this quarantine? And I also want to spend some time on more of the practical things. Now, what I will acknowledge is that you've probably seen a lot of these things on other websites, other places on, keep a schedule or eat a healthy diet. And again, all of those are correct, but what I want to share with you is the why. Why are these things helpful, things that you should be following during this time? So the first practical tip is to stick to a routine. And it's going to be really important, especially for those who maybe even in the summer, you're not going to be taking any classes. It's going to be really important to figure out some sort of schedule because the days are going to be so long and one is going to blur into the other. The reason a routine is important and a schedule is important because it establishes some sort of boundary. Now, if you were going to school and maybe you were a student that went to school and worked, there is a routine and there's a boundary that's created when you get up, you drive to school, you get into a classroom, you maybe go to a library, then you drive yourself to home or you drive yourself to work. And what it creates is these tangible boundaries for when one thing ends and another begins. For a lot of us, if those things are not happening, those boundaries are being blurred. And so everything that you do from a classroom to socializing could be all in one room and there's no space to kind of shift from one thing to the next. And that's probably why a lot of us are also experiencing Zoom fatigue. It's very exhausting to be engaging in this nonstop. So a routine is really helpful because it helps you manufacture boundaries that we may need to reinforce. So it could be a schedule that includes work, self-care, and I would say as much as it's great to be in your day pajamas and then to be changing them into your night pajamas, I do think it's really important to get dressed even if you're not going anywhere and to sleep at a reasonable time. And again, we want to keep some sort of rhythm and boundaries to help us get through this. For me, even though, I have Zoom calls, so I have to do this, but for me, when I put on makeup or get dressed, it feels like coffee to me. I kind of get more alert and rejuvenated as I know that I'm engaging in a new task. And my mind can start to shift. Like, okay, I'm starting something. Let's get ready. Let's get engaged. Get out at least once a day if you can. And again, a lot of this is about getting vitamin D, moving your body, but also exposing yourself to kind of the rhythms of the day. And that actually is very important for your mental health. There are some states in our nation who get really long periods and months of no sun, maybe lots of rain, and actually we see more what we call seasonal affective disorder in those areas just because they're not really getting that rhythm, but also the vitamin D and kind of the changes that you may be experiencing from day to night. So I do think it's important, even if it's just right to your front porch, opening the door, getting some fresh air. If you're concerned about contact, I do encourage maybe early morning or late evening when less people might be out. Reach out to others. So I can't really emphasize this enough. This is a time where, you know, maybe for an introvert, this is fine, but maybe after a while, even this is getting old, right? So figure out a way to reach out. Now, I would say that if you are one of those who are really feeling zoomed out, like you've done way too much, you're just zooming for class and you're zooming for work and you're, you know, all of this, that you can try other methods that actually maybe are more, it feels better. It feels like it's better self-care for you. So things like calling, maybe you don't ever call, but actually calling can be really helpful because you don't have to think about paying too much attention, maybe like in a Zoom, to what everyone's looking at, or how you're looking and how you're talking, but you can really focus on the words that people are saying. And also you can kind of relax other parts of your brain that's very stimulated in a Zoom call where you're looking at so many things at once. You could also go real old school and go to writing cards or letters. And actually, you know, children are doing this a lot right now. And there's kind of this experience of getting something in the mail or sending a card. And these are ways, small ways, to be able to connect with other people and to seek and provide support. I love this. You know, it's a turtle. It says, I can't go on anymore. And then there's a rabbit telling you, you know, just one more flower. Just get to the next flower. And you could tell that he's going to put another flower and another flower. Now, why is this important? You know, sometimes it's really getting to the next flower. And as a part of this quarantine, I'm going to encourage you to just go one pace at a time. And for some of you, you may really relate to the turtle here, that you really are struggling and you're really having a hard time getting to the next thing. And for some of you, you're going to identify with the rabbit, and you may be in a position where you're doing kind of okay, and you feel like, gosh, I am in a position to be able to help others, and I really want to do that. And I would say I encourage you to do that because, one, that it's committed action, and two, that would be very consistent with your values. Some other practical steps. We want to adjust expectations and practical radical self-acceptance. Now, what does this mean? You know, as I'm hearing and talking to students, I think there's a lot of unrealistic expectations for how they should be performing during this time. And there's almost this expectation of, gosh, I'm just home. You know, I should probably be productive more. I should be excelling more. But I often have to remind everybody that we are living in unprecedented times. And although you're not maybe busy in the practical or what we normally would think, we are kind of living with this kind of undercurrent of anxiety, right? And so it's not just peace, it's we're worried in the back burner always about how long, how much longer, is everything gonna be okay? Gosh, when am I gonna have to go out and do grocery shopping again? That's gonna be really stressful. Is this gonna be like this for much longer? And then will I be okay with that? Or am I gonna, you know, so again, this undercurrent of things that we're worried about is kind of something you're always having to deal with. So it's okay that you feel more tired and you're not as productive. Again, we have to adjust expectations and practice radical self-acceptance. And the other thing might be to also recognize that some of the things that you may be experiencing is not about you. So I know there may be disappointments and maybe people that you're reaching out to not getting back to you, or jobs saying that we're no longer hiring. And again, although that's so difficult and really tough, acknowledging and not internalizing that as, gosh, what am I doing? Why am I feeling? But more like, you know what, we're all in a tough place right now, and I can't blame myself for this. And I have to know that we're in this together. We have to figure it out. I also want to encourage you to chunk the quarantine. So what that means is you want to just take it moment by moment. And I could say this is probably the most helpful for me, because sometimes when I think about this as a whole, there's so many different statistics you might have heard. Oh gosh, we won't open until early 2021, or there's this date and that date. And I think when I think about that, and it seems so far away, it's very overwhelming. Chunking your quarantine just means I'm going to take it moment by moment. It could just be, I'm going to just take the next 30 minutes at a time, or I'm going to take the next day at a time, or a week at a time. And to me, that's doable. If we even think back, or initially for us, right, when we heard that the university was going to close, first it said 3 weeks or 2 weeks, but then it kept getting, longer. But initially I felt, gosh, even that's so long. But again, if you're taking it moment by moment, and at the time of this recording, it's been about a little over 7 weeks, right? So knowing that it's doable, it's something that you can do if you take it in chunks. And lastly is to remind yourself that this is temporary. And although this is a very scary and difficult time, it is a season of life and it will pass. Now, the why behind it is that a lot of times when we can remind ourselves of things we've overcome, it helps us to know that we can overcome things again. And that is why memory is important. And that's why remembering achievements or remembering how we've been through difficulty is helpful, because it reminds you that you have that internal strength, that resolve within you to be able to overcome even though this is unprecedented, and even though we've never done it before. And so it's not just meant to be like, happy-go-lucky, but there is a reason behind it. It takes you out of that place of helplessness that I mentioned before, and into a place of, I can have some control. I've done it before, I can do it again. And I would say also just look for the good that's coming out of this. And I don't want to undermine or negate that this is a very, very difficult time. But, a lot of times when, as counselors, we're working with people that have gone through very difficult trauma, or really significant distress, something that we look and move people toward is to find their agency again. What's the potential positive outcome, the meaning that could come out of destruction? What is something that you've learned? Post-traumatic growth. And again, it may be hard to think about this now, but I do think this is a way to kind of think and figure out ways where I can really learn about myself. But also, I think this is a time where we are challenged to think about a lot of things in this crisis. What needs to change about ourselves, our homes, our communities, our nation, and just our world. And this is an opportunity to look back on and say, we made these changes because of it, or we've discovered this thing because of it. And so I do want us to think about that as a way of, again, regaining a sense of control, agency, in the midst of a very difficult time. So we're almost at the end of our time here, and I kind of want to show one more really cute thing, but I just love it. And I think it's so fitting because right now, and especially in the beginning of this pandemic, we were known for this crazy, hoarding, right? But this is a different type of hoarding. It says, are we stocking up again? And then it says, we can't afford to run low on compassion. And I think that's so true, not only for the compassion for ourselves, but the compassion for others. And if you feel like you are really encountering a lot of anger or frustration because someone else has a very different viewpoint, like for instance, if you want to work in healthcare and you can really understand where the healthcare system is coming from in terms of wanting people to stay home, but then you also, maybe someone else can really understand why small businesses would really want to go back to work. And again, there's a conflict in beliefs. But rather than, I think, again, sitting with just the anger and frustration and powerlessness about it, recognizing and having empathy and saying, I don't agree, but I can empathize with why someone might be feeling that way. And if someone is experiencing that, I can see that, and I'm going to try to have compassion about that as well. And we're going to just try to do our best together. So I just want to encourage you all to do that. And as we're wrapping up, I really want to thank you for taking the time to be a part of this webinar. I know that I probably might not have answered everything that you might have come in with, but I hope that you were able to take away one or two things from this webinar series. The last thing that I want to leave you with is just an encouragement that whatever you're going through, that it does not define you, that just because you have feelings of anxiety doesn't mean you're an anxious person, or just because you have feelings of helplessness that you are a helpless person. Feelings are feelings and thoughts are thoughts, but they don't mean or they don't define you. So I want to encourage you to, again, think back to the things that you can control. Think back to the things you have say in. Think back to the values that will lead to committed action and to work towards that. I want to encourage you as you're completing the semester, or if you're watching this in the summer, welcome to the summer. I hope that it's a lighter time for you. Please come check counseling out again if you're looking for other services. This is my last thank you. Again, as a reminder, this is who I am, Hannah Lee. And if you are able to, and if you have some time, it would be really helpful to get feedback on this workshop. And so if you want to pause this video right now and go ahead and copy the hyperlink into a browser, you can go ahead and fill out a feedback form that gives information. It's anonymous on kind of what you thought about the workshop and whether you found that to be beneficial. And that would be it. Again, we are here for you. We are going to be open all summer. Counseling and Psychological Services is here to help you during this time. So please reach out to us, go to our website, contact us. I realize that I don't have it on the screen, but our number is 909-869-3220. You can leave a message and we will get back to you. Thank you so much for attending the workshop here today, and please stay healthy and stay safe. Bye.